So, the first is a follow up to a story that we had talked about just a few weeks ago about how there was movement in the Consumer Protection Bureau to remove medical debt from credit reports. And we talked about the pros and cons. Obviously, the pro being that, you number one, HIPAA compliant, you would be protected from, if you went and bought a car, that person selling you the car wouldn't know that you had medical debt or had a medical issue. Also, because medical debt is kind of a controversial topic over right to medical services, et cetera, it might protect consumers to be able to continue to live a semi-normal life. Um, on the flip side, though, and certainly as dentists and as doctors, the downside of that would be that then that debt would no longer really be able to be serviced. So, for instance, if it wasn't seen on a credit report, if you filed that debt to a collection agency to collect that money that you were due for services rendered, that would never show up on their credit report. So, there would be pretty much no penalty to the consumer for taking out medical debt without restraint. So, a very interesting, controversial topic. I will say that with the new administration in place, I don't see that that will continue. The head of the Consumer Protection Bureau was removed from position. So I think a lot of that particular story is in flux of whether or not medical debt will show up on a consumer report, credit report for consumers. So TBD on that particular issue, but just so you know, that's not been fully settled yet. We talked about it a few weeks ago as a seemingly settled new regulatory issue, but I would now probably suspect that it is in a bit of flux. Okay, last story for this evening. Washington State has been an interesting dental community for quite some time. Let me preface that by saying, in Washington State, they have a very interesting dental insurance market. In that state, 90% of dental patients are insured by Delta, which has created this very unique dynamic of what Delta can get by with and what they can't. And what they're doing in Washington State is often very different from what they're doing in many other states. Because if we're being really honest, that's a monopoly. When one insurance company insures 90% of the patients who have dental insurance in any given state, that would be the definition of a monopoly. Well, the Washington State Dental Association is firing back with some dental insurance reform. They have a couple of state bills that are up for review and for vote. Some of the key items in those bills would include mandating that a certain amount of premium dollars would be spent directly on care. That's the medical loss, dental loss ratio proportion of the bill. Allowing patients to request independent reviews of denied claims, addressing various inequities in the system, and also dealing with these kind of on the fly decisions being made by certain insurance companies. It would hopefully not allow insurance companies to continue to create kind of this bully mentality or pushing individuals to only go to doctors who are in network. There's some interesting things that happen when we have those scenarios. Like, for instance, as dentists, we know that many insurance companies in this scenario will only pay for half of the mouth to be cleaned on one day and the other half to be cleaned on the other day for a very specific reason. Two claims, waiting for two claims of payment, and also to discourage patients from coming back for the second appointment. We know as medical providers, that's a complete disservice to not be able to treat a comprehensive patient or a comprehensive treatment for a patient in one single day. So be it. So hopefully we're going to see more of these. We've seen them kind of upticking since the Massachusetts bill that happened a few years ago, engaging against the current legislative priorities for dental insurance companies and trying to create some healthy boundaries so that patients can receive the care that they deserve, and that doctors can continue to be compensated for the care they are providing. And with that, that's the news.